So we're just Chris and I will just explain the who, why, what, where, and how of Kaatsu. The who is this is Dr. Sato. He is the inventor of Kaatsu. It was in 1966 when he first had the inspiration of how do we actually put bands around our limbs in order to create muscle. That was his first objective back in 1966. Through the decades, he's actually learned more and more what Katsu can do, and we'll explain that going forward. So, of the who, it can be actually anyone. We have everybody from people working in the office to athletes to older people to quadriplegics, people in the airplane, and people who are have all kinds of medical conditions. We also have very, very fit individuals. So we work with people who are very unfit and people who are extraordinarily fit. This includes people in all the major sports. In fact, Chris does a lot of work with the Boston Red Sox and Boston Bruins. Chris is in Boston, in addition to Olympic track and field athletes and swimmers and bobsledders, you name it. Um, and you can see actually a few of those are using Kaatsu actually during the Olympic Games. Um, this was the very first time, sorry, I'll close this. This is actually the very first time, this is Dr. Sato here, with a Navy SEAL. This is Thomas Chaby. He's retired, but the first time that he had tried Katsu, he was actually quite surprised. We went from this single meeting with a captain in the amongst the Navy SEALs to many more. I think we're in 14 bases, military bases, uh, around the United States. And they do a variety of things with Katsu. Uh, these pictures are mostly with their physical training, but we work with them on recovery and rehabilitation also. The rehabilitation can take some interesting, has taken to some interesting places. This is U.S. Marine Corps Sergeant Justin. Unfortunately, he had an amputation, and I wanted to show you these two videos here. Chris, tell me if you can hear this.
Cycle medium.
Yes, Stephen, yes.
And it started at 10 pounds. Actually, he started way too heavy, 25. We immediately went down to 10, then 8. Now he's at 5 pounds. Justin, Katsu cycles with movement like this. What's it feel like?
Oh, it's ridiculous. Feels like I'm doing 80 pounds rather than 5.
Get after it, brother. How's your left arm feeling?
Like I got weight in that one too. It's feeling good.
Excellent. Keep going, brother. Give me 2 more. Good job.
So imagine that a young man without a hand is simply moving his arm up and down, and he said it feels like he's uh, pushing weight with his arm. This is after that very first try with Katsu.
Justin, this is going to Dr. Sato now. What do you think?
Hey, Dr. Sato, I've been working with y'all for the past couple of days with this Kaatsu program, and it is just absolutely amazing. I used it yesterday, and I'm using it today. Last night, my pain was significantly reduced when I was there. It was just impressive, man. I mean, obviously amazing. I put my prosthetic on, and I could fire it better. And this is just an amazing program, and I really appreciate it. I really do.
Awesome. Thanks, Justin.
No worries. Thank you.
And you'll be getting one in a few days. Compliments of Operation Healing Forces, brother.
Katsu strong, brother.
Awesome. Thanks, man.
No worries.
We also deal with other individuals. You can see here an individual with bands on his residual limb on his leg. also on his arms. He has a smile, and that's what we're seeking. We seek the Kaatsu smile. We have others, and you can see him here, another amputee with the Kaatsu bands on his legs. There's also, in addition to the young soldiers that we deal with, we obviously deal with athletes, Olympic athletes. I wanted to share this one story with you. I'll try to make it fast, but it is a remarkable journey of 28 days. So Todd Lodwick, it was a defending silver medalist in Nordic combined. That's ski jumping with a 15-kilometer cross-country ski. So they were favored to return to the podium in the 2014 Winter Olympics that were held in Sochi, Russia. Unfortunately, Todd was training in a pre-Olympic training camp and he wiped out. Broke his humerus, tore his ligaments in his left arm. You can see some of the x-rays here. And this is 2 days afterwards. He came back from Europe to the United States, where I'll stop it here, where the doctors had recommended surgery. But if he had surgery, of course, he would not be returning to the Olympics. And his dream of getting a gold medal would be dashed. So here is Todd. This is the arm that's broken. The doctors did say, well, if you're going to do Kaatsu, you need to keep the arm immobilized. So we had it in a sling, but you see a Kaatsu band on his arm here.
In a pan?
This was our old unit. Look how big it is. This is 11 years ago. We have the team doctor there. He's looking at his watch, putting the Kaatsu air in the bands every 30 seconds and then releasing the air. That was our old version, our very first version of the Kaatsu Master that we called it.
I know, right? Okay,
This
slow it down a little.
This is Todd.
Okay.
Again, we're keeping his arm still, but we're trying to create lactate in his arm, and that will actually help his bone and his ligament heal. You can see here, he's not doing anything with the injured arm, except he's opening and closing his hand. Again, trying to build up lactate. This is an Olympic athlete trying to return to the Olympics within 4 weeks. We also had him with the leg bands on. You can sort of see the leg bands here. And he was practicing for his cross-country skiing on a cross-country ski treadmill. And again, more cross-country skiing with the leg bands on. This is him practicing his jumping motion, again with the bands on. He was doing 2 sessions a day. This is 7 days after his upper arm was broken with the torn ligaments. And you see here, he's doing a variety of exercises now without the sling on his arm. This is actually the moment he was cleared by the doctors to compete in the Olympics. And he was obviously quite happy. No surgery, no intervention other than Kaatsu. This was right after his injury. This is when he was cleared by the doctors to go to represent the United States in the Olympics. This photo, there's 1,000 words behind this, but I'll keep it quick. Remember, his left arm, 28 days before, was broken. His humerus was broken and his ligaments were torn. Yet in the opening ceremonies, Todd was chosen as the U.S. flag bearer, an honor that the athletes themselves vote upon, and he's carrying the American flag in his formerly broken arm. And then this is a picture of actually Todd on one of his jumps during the Olympics. Um, in addition to athletes, this is Dr. Sato in his younger days working with some sumo wrestlers. This is me doing some testing on brainwave activity with Kaatsu. This is Dr. Nakajima and Dr. Sato, their colleagues. They were giving a lecture at the Harvard Medical School, but Dr. Nakajima is most well known for a 10-year study of over 12,000 patients on the safety and efficacy of Kaatsu. Now, because he's a cardiologist, over 2,000 of those patients were people who had cardiac issues. Maybe they had a heart disease, heart surgery, a stent, a stroke, a heart attack, etc. So these two gentlemen were really at the forefront of Kaatsu. Well, Dr. Sato since the very beginning, Dr. Nakajima, the cardiologist, starting in the 1990s. This is his colleague, Dr. Morita, again working with, this is a heart attack survivor. You could see her doing some rehabilitation with her Kaatsu leg bands. I was fortunate to be able to be taught and mentored by Dr. Sato, Dr. Nakajima, and Dr. Morita at the University of Tokyo Hospital, where they were doing all of this testing and groundbreaking work between 2004 and 2014. You can even see Dr. Morita using a Kaatsu band on a patient in the critical care unit. This is pretty incredible. That was me, actually. I'll go back to that. So what is Kaatsu? Kaatsu is a modality that Dr. Sato came up with when he was doing his he was actually in a Buddhist ceremony. One of his relatives had passed away and he was kneeling down. This is called seiza, the Japanese formal sitting posture where you sit on your heels. And at the time, when you do this for prolonged periods of time, your calves actually start to hurt, actually. And Dr. Sato reached down, felt his calf, and his calf felt pumped up like he had just done a bunch of heel raises. And he thought to himself at that point, why is my calf pumped up? And his first thought was, well, blood must not be going to my lower leg. And maybe if I somehow restrict blood flow to my lower leg, I can simulate an exercise where my muscles pump up. That was his first thought. But over the following 30 years, he realized it was not that it was not because his blood was keeping out of the limb. It was because the blood was being engorged in the limb. And ultimately, Dr. Sato was issued a U.S. patent that for the strengthening the blood vessels with extreme ease and a compression and decompression system. That is what the Kaatsu equipment and modality is. It's a way to strengthen our blood vessels easily. Fast forward, and in 2022, one of the International Olympic Committee members of the Medical and Scientific Commission, Dr. Yanis Pitsilaitis, described Kaatsu at the World Congress of Sports Medicine as such. Positive adaptations for muscle mass, muscle strength, functional capacity, quality of life, and muscle mitochondrial function are achieved for people of all ages and all walks of life with minimal movement and minimal effort with Kaatsu. And ultimately, that was Dr. Sato's goal. Now, it took him decades to get to that point, but with his self-experimentation, with his experimentation and testing and clinical practice with Dr. Nakajima and Dr. Morita, they were able to achieve this. And this is what Kaatsu this is what Kaatsu offers all of us. So what is Kaatsu? Right now we have two models. We have the Kaatsu B2 model and the Kaatsu C4 model. 2 stands for a second generation, 4 stands for the fourth generation, B stands for Bluetooth, C stands for connected or cycle. So you see these tubes here. These tubes go from the controller unit to the bands, and you place the bands either on your upper arms or upper legs. The difference between the C4, which has tubes that push the air from the compressor inside the controller unit to the bands. The B2 has its own controller on each of the limbs. So in this case, with your mobile phone app, COTS Connect app, you actually use your phone and direct the air from the controller into the bands and out of the bands. So those are the two products that we currently offer. Much smaller, much more portable, much easier to work than the very large Cuts Master product that we had way back in 2014. This is how Kaatsu looks, and quite often if you go to the internet and you Google Kaatsu, sometimes you get this BFR, blood flow restriction. These are the images and perceptions that we see. They're usually burly men or very extraordinarily young, fit women putting bands around their arms in order to build muscle. Well, that is one application. It is only one application. If you look at the band here and you saw that at a gym or in a medical clinic or a physical therapy clinic, etc., it would be natural to think, oh, that's some kind of blood pressure cuff. But it's not a blood pressure cuff. This is a young athlete. She has one band, one Kaatsu band on her left side and a standard blood pressure cuff on her right side. You can see the dramatic difference between these two products. This blood pressure cuff or a tourniquet is meant to keep the blood out of the limb, and Kaatsu is designed specifically to keep the blood in the limb. So they serve two completely different purposes. This is elastic and narrow. This is inflexible and very wide. We've all had our blood pressure taken, and we know when that tightens very much, that it feels uncomfortable, but it's only for a moment in time. And so the healthcare professional or machine can measure our blood pressure. This here is snugly put on either the upper arm or upper leg, and its entire purpose is designed so the flow of blood from the torso goes into the limb, the arm or the leg, without impedance. So blood goes in. When this band is inflated, then the blood coming back is slowed down, and therefore you get engorgement of blood in the limbs. So this is a schematic. We can understand a blood pressure cuff. The air is inflated in the band, and the band applies pressure toward the arm, which is signified by this circle here. The Kaatsu band, in comparison, when it is tightened, and it's tightened much. This is again an illustration. It is tightened or inflated at a much lower amount. In addition, as you move the arm or as you actually stand there, this band actually stretches outwards as well as being inflated inwards. This design here enables the blood to go into the limb without impedance. And this design here actually keeps the blood out. So although it may look like a blood pressure cuff, the Kaatsu band is designed differently. And we can see it here. This is image of the arm, the armpits here, the hands on the left side. This is the artery, and this is the vein. So the arteries bring blood into the limb. The um, veins bring the blood back from the hand or the foot. So you can see here, even, and I believe this is at 300 SKU. So this is a fairly tight um, inflated amount on the Kaatsu band. The band would be in this position here around the arm. And you can see the vein remains I'm sorry, the artery remains intact. So blood is going in normally. And on the way back, you can see that the vein is slightly compressed here, but there's still blood going out. So blood in, blood out, but on when its band is inflated, it is slightly compressed. And that's why you get a blood engorgement in the limb, which is exactly what we want it to have with Kaatsu. Now, we've all had biology classes, and we're probably familiar with this illustration. The red indicates the arterial flow, or the blood going from the heart out to the hands or the legs. The blue signifies the blood coming back from the hand or the feet to the heart. This is what we imagine our vascular system looks like, but in reality, our vascular system is much more infused with capillaries. Yes, there are veins and arteries, but there's also just thousands, tens of thousands of miles of collective capillaries throughout our body. They're very, very tiny. And Dr. Morita, Dr. Sato, and Dr. Nakajima understood this fact. And so when you have a band around an arm or a leg with Kaatsu and you gently um, tighten the band or you inflate the band with air, what happens is what we're seeing here with this 56-year-old Kaatsu user. This woman here, we asked her to put a Kaatsu band on one arm and leave the other arm without a Kaatsu band. We started to do the Kaatsu cycle mode, which is pressure on, pressure off, pressure on, pressure off. And this is the net effect. This is what we call the Kaatsu color. This is what Todd, the Olympic silver medalist who had a broken arm, he was experiencing twice a day during that 28-day recovery period. This is what the Olympians were doing in their warm-up and their recovery from their Olympic events. They were forcing the blood into the small capillaries of their arms or their legs and then releasing it. Pressure on, pressure off, pressure on, pressure off. When there's pressure off, the band is deflated and this blood rushes back to the torso. And that when the blood rushes out, it leads to a process where nitric oxide and vascular endothelial cells are produced. This is one of the goals that Dr. Sato, Dr. Nakajima, and Dr. Morita were looking for. They knew that this was improving the vascular health of their cardiac rehab patients. So when can you use Kaatsu? You could use it anywhere. This is actually a breast survivor. She was strengthening the side where she had the a breast cancer. So in this case, we did what we call single limb Kaatsu. We inflated this band, deflated it, inflated, and she's doing bicep curls with the same amount of weight, 2 pounds, but on one arm, her weak arm, we've inflated the band, creating a muscle stimuli that leads to a hormonal response because we wanted to make this side of her body stronger. You can do it in the office. This is me here. We're just doing, I was doing leg curls here. I was just working on my core here. Where can, where can you do it? You could do it at your home. You could do it relaxing as you're retired. You could do it in the office. You could do it relaxing, reading, writing, texting, watching a movie, reading, what have you. So that we always say Kaatsu can be done anywhere by anyone at any time. Now, why would you want to do all of this? Our vascular system is quite vast, as we saw in that earlier picture of the capillaries. And if we lined them up end to end, the length would be 96,000 kilometers, or about 60,000 miles, and it would circle the Earth 2 times. Dr. Sato and Dr. Nakajima understood this, and they understood when they were putting the pressure on, pressure off, and modifying the blood flow, so allowing the blood to be engorged in the arms and legs, and then releasing it every 30 seconds, that they would be producing nitric oxide and vascular endothelial cells. This is one of the primary goals that they had, and this is why we have this kind of image. Again, this is the picture of that same woman who we had her do Kaatsu on one side and not do Kaatsu on the other. And you can see the net effect. This is her natural color. This is her Kaatsu color. In addition to this gradual engorgement of blood in the limbs, we do that every 30 seconds. It's followed by 5 seconds of decompression. And when that happens, the both the fast twitch muscles and the slow twitch muscles fibers are activated. Now, this is very important if you're an athlete, but it's also important as we age. We we will all face sarcopenia, or the decrease in muscle mass and muscle strength as we get older. But Katsu is a way to maintain that muscle mass, or actually increase it depending on what kind of exercises you do. What happens is when we stress the muscle with the bands on the arms or legs, we create a thing called lactic acid or lactate. And this information, this built up lactate in the muscle, is sent by the central nervous system to our brain, to our pituitary gland that sits behind the eyeball. And the pituitary gland senses stress in the muscle, and that it naturally produces growth hormone. And we normally do this with weights. So if you gone to a weight room or a fitness gym and you're lifting weights, what you're doing here is you're putting stress in the muscle. Sometimes you're tearing the muscle fibers, a little micro trauma in the muscle fibers, and the process is exactly the same. The process, you built up lactate, sends a signal to the brain, brain sends out growth hormone to help repair that micro trauma, those little tears in the muscle fiber. Except with Katsu, you're not creating those micro trauma. You're not creating that muscle tears. And so it is a very efficient and effective way to either maintain or build muscle. Now, how do we do this? Uh, this is basically a summary of what I said before. You put a band, again, it's an illustration. So we put a band around an arm or an upper leg, whether you're using the C4, B2. It engorges the muscle in blood. This actually helps the vascular tissue become more elastic. And if we do movement, then it's that stress that we put on the muscle, either with very low weight or no weights at all, sends a signal to the brain, and the brain releases growth hormone that actually flows through the vascular system, enabling our muscles to be well maintained or increase. So Kaatsu is actually a system, a modality that works on the vascular system. And as a result, it actually helps the muscular system in addition. Some of the things that are produced, we've mentioned this before, are earlier in the presentation: nitric oxide, human growth hormone, insulin growth factor, vascular endothelial cells, plasmalogens, ceramides, beta endorphins, BDNF, which is brain-derived neurotropic factor. All of this was understood and studied and documented by Dr. Nakajima and Dr. Morita, Dr. Sato during that 10-year period between 2004 and 2014 when I was being mentored by them at the University of Tokyo Hospital. And so what they were doing here was setting the groundwork for Kaatsu Global, which at the end of that 10-year period, Dr. Sato and I decided to start Kaatsu Global, and now we are expanding around the world. I think this is just showing one of our cut specialists who was doing some squats, and I think I messed up on the video here. So I'll stop sharing the screen here, and I will open it up to questions. You can either put it in the chat room below or in the Q&A or raise your hand. And I think we have one here. Um, the first one is, would you have any hesitation using Kaatsu on arms and legs 30 to 60 minutes after using a traditional sauna for 30 minutes? No, I would not have any hesitation. What I would recommend, though, is doing the opposite. And that's actually what a lot of experienced practitioners do. They do Kaatsu on the arms and legs before they get into the sauna. In fact, Dr. Sato is a strong advocate of doing what he does is he does his evening Kaatsu workout, then takes a traditional Japanese bath, hot bath. Then he does a cold plunge, hot bath, cold plunge, and he does that 3 times. So there's no hesitation to do Kaatsu after, but we recommend if you had a choice and if you had the ability to do it before your sauna. Now, the reason why Dr. Sato does it this way is actually in wintertime, when it's cold in Japan, he does his last session is in the warm water sauna, and he gets out and he gets, now he's warm. In the summer, when it's very hot and humid in Japan, his last emerges is in the cold water plunge. So he gets out more refreshed and cooler. But you can do it either way. Next question is Kaatsu contraindicated with femoral fracture repaired with screws? No, there's no bone fracture otherwise where Kaatsu would be contraindicated. What you should do, however, because it's in your femur, what you may want to do is start, obviously, any injury, any surgery, you want to confirm with your surgeon or healthcare professionals that if you can do Kaatsu, and if they're not aware of Kaatsu, just email us at info@kaatsu.com, and we could provide you, or we can provide them, a variety of studies and information that will help them understand Kaatsu more if they had any questions. But if there's any bone break with screws or otherwise, it's not contraindicated. However, some people might feel uncomfortable. And in these cases, you can put the Kaatsu on your 2 arms and then on your other leg, your non-injured leg. Do that for a few weeks, and then you can as your body acclimates to Kaatsu, as you become more familiar and comfortable with Kaatsu, then you can add Kaatsu on your other leg. Let's see.
Steve, Steve, sorry to interrupt. We had a question that came in, I think, before you logged in, so I
Okay.
collected the question. The question was, I understand that increased production of nitric oxide happens with Kaatsu use. I'm assuming this effect is localized to the limbs involved. I'm wondering how significant an increase this is. So I can repeat that if you want, but
Yeah, no,
that
no,
question.
it's okay. So when the nitric oxide is released, it actually goes through the vascular system. So it actually goes, even if you, like I have a Katsu band on my arm, I'll turn it on right now. It's the B2 unit. Just have it on one arm. Oh, it's, oh, I need to turn on my phone. Well, when I turn on my phone, the issue is when the nitric oxide is released in my arm, it actually goes in my uh, vascular system and it actually floats around through the entire body. So let's say, and Chris actually had this himself. Chris had his first use of Katsu was actually the um, uh, broken rib. He had two cracked ribs. And when he was first treated with Katsu, they did Katsu on his arms and his legs. And he was trying to figure out, well, why, if you do Katsu on my arms or my legs, is my rib actually healing? And the reason why is we're using the Katsu on the arms and legs to act as the catalyst for all these mechanical, biological processes to occur. So we're using the Katsu on our arms, generating that nitric oxide, generating the vascular endothelials, generating the human growth hormone, but they actually flow through the entire body. When you have an injured part, injured body part, every cell in the human body has a receptor, and that little receptor basically says when it's broken or ruptured or torn, strained, whatever, is saying, "Hey, help me here." And when those hormones go are floating around, they will skip all the places where you're perfectly fine, and they will be attracted to the places where you are injured. And so in Chris's case, he had a broken rib or two cracked ribs. He was doing katsu on his arms and legs, and the surgeon, the doctors that he uh, saw were absolutely astonished with the speed of repair in his ribs. So I think that was the first part of the answer. And the second part of that question, the second half, I forgot. It's
Stephen, I'll repeat it. So it was the person who asked the question was, I'm wondering how significant. So again, I'm
how
assuming the
significant. Yeah.
effect is localized. I'm wondering how significant an increase this is.
Um, it's significant enough that and again, it's hard to say, is it 20% more? Is it 15% more? In the case of someone like Chris, who was at the time he was coaching at Harvard University, he absolutely had to get back to coaching his athletes. He couldn't sit around on a couch at home. And the same thing with Todd. He had 28 days to get from a broken arm and torn ligaments to competing in the Olympics. And so in these cases, they're doing a lot of Katsu. They're doing Katsu 2 or 3 times a day. They're actually doing a lot of vigorous movement with their limbs during that period. So in these cases, the amount of nitric oxide is significant. Is that twice as much as we can imagine? In the case of Todd or Chris, we did not measure those. But most people, you're only doing Katsu like I do Katsu, which is mostly when I'm in front of my computer or talking on the phone or walking my dog. I'm not using it intensely, but I'm doing it um, uh, steadily and consistently. If you do it steadily and consistently, the amount of nitric oxide that you will increase is actually a question that I should pose to Dr. Nakajima because as a cardiologist, he was measuring these things in the course of his career. So I will ask that question to Dr. Nakajima and see if I can get a definitive percent amount or data that he will have. The next question is, can Kaatsu help build bone density if you have osteopenia or osteoporosis? The best way to do that is what we call um, uh, body weight Kaatsu, or in other words, walking. And in this case, it's a little bit of a complicated process, but if you're interested or if your doctor is interested, we actually have a good 8-page synopsis of how Katsu, when you're doing something like Katsu walking or squats or even resistance exercise, that can reverse and help you build bone density. So if you want that data, if you want that paper, we can send it to you. Just send us a email at info@katsu.com, and we'll send you that information in a peer-reviewed published article. Let's see. Do we have any?
Steve, there's no more questions, but I do think that we have a very special person here who might be interesting just to hear from, uh, which is, I think he's still here, which is Joe Lowrey.
Oh, wow, Joe Lowrey. So Joe is a truly a special person. Chris and I met him years ago. Um, and Joe is one of our true heroes. He's a Purple Heart recipient. He is Joe, if you could turn on your camera, if able.
Yeah, trying to figure that out.
Uh,
Sorry, guys.
okay, no problem.
I'm over here like, ah.
Okay, so Joe grew up in Long Beach, California. Shout out to the LB, Joe. And
OBC. Where am I
yes.
the damn camera thing?
And he, after college graduation, he joined the U.S. Army, became a Green Beret, was dispatched all over the world, but one of his last deployment was in Afghanistan. Make a long story short, he took a bullet to his helmet and
Will there be like a button for this thing? I'm looking all
uh,
over. I'm like, what am I looking for? I keep getting the volume thing, but where do you put
look at video. You see video on your left side of your screen?
I see audio and then a mute thing but no video.
No video.
So I
Okay.
don't know if I put the wrong one.
Oh, it's okay. Uh, Joe, he's a handsome young man. Um,
I
but
am dressed nice today being it's Sunday, so it's like,
yeah.
dang it. It's too
Oh,
bad.
great. Great. So we met Joe after he was dispatched, after he was released from Casa Colima. It's a place where, unfortunately, Joe was a hemiplegic. And I don't know, Joe, if you want to
Yeah, I
tell your
can.
story
Yeah,
and
sure.
yeah,
The book is in the process of being published right now, so I mean the whole
great.
story is going to be out there. But yes, as Steven said, I took a PCAM round, which is a belt fed Russian machine gun, 7.62 caliber, a lot of oomph on it, and it went through my helmet, put me in a month-long coma. Came out of my coma, began my rehab journey. That initial injury was July of 2014, just to give some context on the time frame, and came out of my coma a month later at Palo Alto VA Rehab Center, the polytrauma unit up there in Northern California. And I met up with these guys, like he said, when I was upon discharge from the military, and Give me one sec. But yeah, I met him, and after I was medically retired, I stayed in rehab for a long time, fighting the medical evaluation board to get medically chaptered out of the military and medically retired. Obviously, that was not an option for me to go back, but in my warped mindset at the time, hard charging, I thought, oh, I can go back, and as long as I can get to walking. And then, like Steven said, he encountered me upon my return to what would be home for many years, and began the journey of getting better at getting better, and using Kaatsu as a key essential tool for that, because it helps me with doing, like I heard him talking about it earlier, about people wanting, you need to move more, and osteopenia has obviously become a problem for me with non-movement and being paralyzed or hemi paralyzed.
Uh, Joe, tell us how you use Kaatsu on a daily basis.
Well, I got it running right now on my arm, like you were talking about single arm use. So because I don't have, I've kind of came up with my own little thing before. This is research and development, but I'm doing what I've come up with, coined the phrase Hemi protocol, where I have just one left arm and one arm and one leg band on, and I just do half my body, the paralyzed side of my body.
Great.
I haven't always done that, but just while I'm waiting for a proper fitting band, I just came up with that one.
Uh-huh. Wow. Okay. Great. And you use it before you go to bed too, correct?
Yes, absolutely.
And what have you seen those effects?
A calming effect on the nervous system, and then
Yeah.
better sleep,
Yeah.
deeper sleep.
Okay. Great. Great. Um, we actually have we did a lengthy interview with Joe. Oh, Joe, was that like a year ago or 2 years ago? I forget.
Yeah, I don't know. I know it's on your channel, but
Yeah, yeah. It is pretty good. And if anybody has any interest in watching that video, it's really educational, inspirational, and you know, mm, people like Joe really make our work very satisfying, and really he really inspires us to continue what we're doing. So, thank you, Joe, for jumping in on the call today.
absolutely. I enjoy the learning and
Yeah. When you wake up
always.
in the morning, Joe, and your caregiver comes, what are the first things that you do with the Katsu?
Oh, so like I was saying, I've been doing the Hemi protocol
Uh-huh.
right now. So like I have the bands right at bedside, because after going to bed at night, I just set them on my cane, and they'll put them on me, my left arm
Okay.
and left leg, and I get them on right away. And then, oh, now I'm with certain caregivers, I'll walk a little bit to my wheelchair and then do my normal stuff, because I try to incorporate it wherever I can safely, of course, but it's
Yeah.
like you were saying, hey, if you're sitting at a, sedentary and sitting at a desk, it's like that's one way to help yourself get stronger.
Yeah.
And I
Yeah.
can't do what I want to be doing. So it's a nice biohack.
Yes. Yes. Yeah. That's great. That's great. Um, does anybody have any questions for Joe?
Steve,
Joe, we have 40 people on, so I didn't know if you wanted to.
Steve, if I could just sort of interject
Uh-huh.
with Joe, and Joe will appreciate this. I've had the pleasure of knowing Joe as well, and actually working literally hands on with him. And I think for me as an exercise scientist, what's very interesting is to see that Joe has used Katsu as sort of a, you never want to you know, Joe is very spiritual, as am I, but I think with the science of Katsu, it really makes sense that spirituality and science come together. And when we used it together, it was really a way for him. And Joe, correct me if I'm wrong, to sort of kickstart the system every time when we would do an extended bit of walking. He spent several days with me in Boston. We went to a Boston Bruins game Shout out from general manager, by the way, uh, Don Sweeney, to you, Joe. But
Aw.
it allowed Joe to sort of kickstart his day and kickstart what would be a long session of being mobile. And for anyone, if you watch our video and you see the bullet that literally went through the head of through the skull of Joe, you would say it is a miracle, and we're happy that that miracle worked and that Katsu's allowed him to sort of I think of it as a way for him every day to, it sounds really silly, but to think that somebody will drink a cup of coffee to get their day going. Joe uses Katsu to get his day going. Joe, I think that's a fair analogy. And it really just allows him every day. And it's just like someone will have a cup of coffee every day. Joe uses Katsu to sort of kickstart his day and kickstart a long mobile. So when we would go to the Bruins game or be out in the conference when we were out here in Boston, it really allowed him to be pliable, is the word Joe uses, because you see he has a lot of spasticity, and it's just a great tool for him. And I think for anyone who's listening or anyone who listens to this video to overcome maybe a barrier that they didn't think they could get through. I think that's fair, Joe, that I say it like that.
Absolutely. That's more than fair. It's, it'll help people. Like my one of my injured brothers, double amputee vet. He, I share with him now that I've seen you guys doing it on amputees. I'm like, okay, it's definitely safe for you. And he always says, Joe, I am so, amazed at how much like you continue to do even after such a severe, because he had a TBI as well. He got blown up, so he understands that part and what that can cause. But he's like, you took a bullet to your head. He's like, you're being too hard on yourself. I'm like, no, I it's like, why can't I do that?
Yeah.
It
Joe,
just
we actually have a question, Joe, directed to you. Somebody, one of the listeners is asking. We heard that Joe has spasticity, wondering if Katsu has helped him with this difficult issue.
yes, absolutely. It's more than medication. That was the first thing Stephen and I both noticed when he came to
Yeah.
my place before I moved in. He was like, I was like, whoa. It decreased it immediate. Like medication, you got to wait to take it, and Botox. Like I've done the full gamut dealing with spasticity, and it's like it's instant effect. So I'm like, man, if you're, I can't, I can't think of a better way, and not because anything non-pharmaceutical to me is huge benefit because nobody want, I shovel enough pills down my throat every day due to my
Yeah.
traumatic brain injury. So I'm like, anybody that
Yeah.
suffered a catastrophic injury would, could benefit from that holistic or naturalistic
Yeah.
way of doing things, or however that's holistic. I don't know if I'm saying it right or what, but you know what I
Yeah.
mean.
Yeah, yeah. So what happens is, in Joe's case, in the case of other paraplegics and quadriplegics, you can see immediately when that their hand or arm is uh, uh, basically stiff and tight, that we're able to, as the blood is going into the limb and out, in, out, in, out, we're able to actually extend the fingers, extend the hand, extend the wrist, extend the elbow. And we know that this has really provided a lot of relief to these individuals. And I actually put in the chat room and in the Q&A the video link, the YouTube video of Joe. And I encourage everybody to watch it. It's very cool. I've seen it numerous times, and I still go, God, Joe, how incredible are you? So let's see. There
I
was
think, Stephen, when you consider that we've been very honored to see pictures of Joe in the recovery room when some people didn't think he was going to make it, and he had former President Barack Obama standing over him. You wonder, wow. So yeah, thank you, Joe. Real cool that he's my friend too.
yeah. There was another question. Can I use cuts bands over sweatpants or sweatshirt? Do I get the same effect? Yes, you can use the bands over any amount of uh, attire. In fact, Chris, who lives in Boston, has a very good biohack exercise. He actually shovels snow um, with the bands when he has his winter gear on. And Chris,
Yeah,
I can't
I put it.
imagine how hard that is.
I put them underneath my Patagonia jacket and in the cycle mode, and I'll go out. And we will have snow on Tuesday, so that's what I'll be doing. Tuesday afternoon, I'll be shoveling snow with these exact bands and my Patagonia jacket. So
Yeah.
it's a great. It's brutal but good.
Yeah. And we actually have some husband and wife duos. So let's say the husband is larger than the wife, and but they only want to buy one set of bands. So I always encourage them to buy the band for the larger partner. The smaller partner, and again, it could be someone with the larger arms or larger legs. They could wear a thick t-shirt, a sweatshirt, a jacket, etc. around the band. The band, as Chris and I both have it on, it compresses snugly. So whether you have pants or a jacket or a sweatshirt or sweatpants, it's all the same. The compression is entirely around your limb, and it just inflates in towards the limb. Yeah. So, and when we work with athletes, they have all kinds of different gear. Some of them, wear tank tops or no shirt at all, but on the guy side, but the other athletes have all kinds of uniforms and sweats on, so no problem there. All right. Any more questions? Um, if you want to look at the video with Joe, I did put it in the chat. I'll do it again, and then I'll also put it in the
I put info in there, Stephen. Info
okay.
at
Yeah.
Kaatsu.com.
Okay. Great. Great. All right, everybody. Well, thank you very much for joining us on a Sunday evening, and we have our big sale tomorrow, Cyber Monday, and hope some of you are interested in it. All right, take care. Thank you, Joe.
Thank you,
Appreciate it.
Joe.
All right, take care. Bye. Oh, was there another question?
I know they just sent it to our. They
Ah,
just said that
got
they
it.
sent a question to
Okay.
our. Yeah.
Okay. All right. Thank you.